back to the Clinical Coder YouTube channel. Thank you for joining me today. Today we are going to talk about something really exciting, which is called a portfolio career. So what is a portfolio career? I mean, I just thought you go to university, become a pharmacist or any kind of profession and just continue doing that role for the rest of your days until you find something else. Well, actually, a portfolio career is where you develop your skills and to be able to diversify your portfolio. This is something that is really exciting and definitely becoming more apparent within the pharmacy profession, with pharmacists and pharmacy technicians in the UK and around the world. So what actually is a portfolio career? I mean, I know I've given you a definition, but what is it really? So say for example you start off your pharmacy career and you train in community or retail pharmacy and you want to stay in that arena, which is really great, really fantastic, and you stay there. But as you're there for a few years, you start to think, okay, what other things can I do? What other things are more interesting? You might split your week and say, okay, I'm going to do 3 days community and 2 days in a hospital, or 3 days community and 1 day in a GP practice, just to start to diversify your experience and your exposure. That is your first step to a portfolio career. So it's basically where you start to gain more skills and hone on different skills to diversify your offering, not only to different employers, but also for yourself, to start to explore different skills that you might enjoy. Another example of a portfolio career is, say for example, you start thinking about, actually you quite like technology and you want to move into that realm. You could start to diversify your career by becoming a content influencer or a content creator, or even move into learning how to code and hard coding health technology applications. So one of the things that I've done to try and build a portfolio career for myself is diversify my offering. So currently I work in the community pharmacy a few days a week, and I work as a prescriber as well to be able to support patients, because I really like doing that clinical angle. But not only that, I love health technology. You can have a look at some of the places I've been and some of the health technology I guess you could call it applications that I have built on my other playlists on my YouTube channel. But I love coding as well. So I will take that time to build little health technology applications, but also with my knowledge of coding, I can now bring that with my clinical knowledge and support an area, what we call as clinical safety. And that's basically supporting health technology companies with their applications to ensure that they are clinically and patient safe and friendly. So that's kind of how I diversify my career. I'd love to know if you have any ideas or any ways that you might think that you would love to reach out, or different areas. The other place I haven't touched on at all actually is pharma and pharmaceuticals. That's a really great avenue as well for pharmacists to diversify their career, where they can work in pharma in industry to either be a sales rep, a patient engagement rep, a clinician engagement rep, or just be more involved in the drug discovery and drug development process. So basically the world is your oyster, and if you are interested in different pharmacists doing different things, I urge you to listen to a podcast a colleague of mine do, which is called the Pharmacy Podcast, and that is where we interview pharmacists with really different diversified careers. I'll link the link down below, and yeah, let me know what you think, and I'd love to know more about what you guys do on a day-to-day. Thank you for watching, and please subscribe to my channel if you'd like to know more, and any kind of content videos you might want to see, please let me know. Thank you for watching. Bye.